Hello, this is Graham Brown, Principal with NextGen Advisors. It's the second week of March and spring doesn't seem quite as elusive as it did before. As of this week, over 31 million residents of the United States have been vaccinated against COVID-19, which is tremendously encouraging news. Meanwhile, the number of confirmed cases exceeds 29 million, with over 527,000 loved ones having died due to the pandemic. Today I'll be joined by my colleagues, Dr. Betty Rabinowitz and Dr. Marty Lustig, to explore challenges in tracking who has been vaccinated and explore the role that health information technology needs to play in this effort. We also want to touch on new guidance the CDC issued this week related to how those who have been vaccinated can begin to resume social interactions and other activities while ensuring they continue to keep themselves and others around them safe. Welcome, Betty and Marty.
Hi, Graham.
Hi, Graham. It's great to be here.
Marty, we all read an opinion piece this week published by IEEE, which is a technical professional organization that serves health information technology audience, among others. In that article, the author lays a great deal of the blame on electronic health records, lack of interoperability with each other, as one of the primary reasons that there are challenges in tracking who's been vaccinated. To me, that seems like a bit of a red herring and a little bit off point, but I'd be interested to hear your take on that article.
Yeah, I agree with you, Graham. It was interesting to me that the article headlined the problems with the EHR, and the author did mention, I think, what are some of the other more significant issues, but seemed to be really focused on laying the blame there. I think one issue that's really important to understand is that the overwhelming majority of the vaccines are not being distributed to outpatient physicians' offices. And so all those doctors' offices that have EMRs are playing a very small role in the whole vaccination process at this point. So laying it at the foot of the EMR in that regard doesn't make a whole lot of sense. I think the other more pervasive issue is that it misses the point of the problems we have with our public health infrastructure that have been exposed not just by the vaccination issues, but by the entire pandemic. The lack of coordination and consistency across the country and the underfunding of infrastructure that gathers data nationally and positions that data to be able to coordinate interventions, I think has really been fundamental to the challenges we've faced over and over with all the issues that have come up, from PPE to guidelines for closing or opening businesses, all the way to vaccinations.
Betty, what are your thoughts on this piece?
Yeah, I feel that the article was an old echo of the past, where all of the ills of the healthcare system can be pinned on the EHR. So the technology to support interoperability exists. EHRs have done a lot of work around uniform standards and communication standards that allow sharing of information. Care quality is a initiative shared by multiple stakeholders, many of them EHRs. NextGen is one of the EHRs participating in that. That allows sharing information across a large network of physicians. 1 million physicians across the country can share information in near real time. HIEs have had the capabilities of sharing information. The will to share this information hasn't been there, and regulations have not supported sharing information by creating a uniform patient identifier, which doesn't exist, which encumbers the whole process. The HIPAA and privacy rules were given precedent to the interoperability needs around this, and we're paying the price for that right now. So clearly there is a lot of opportunity to expose what is available, what can be done, the connections between vaccination registries at the state level that the EHRs have been supporting for a long time. I felt it was kind of almost old, almost an echo of a past. We've get over it. The EHRs are no longer the evil presence. So I was a bit disappointed by the tone that article struck.
Interesting comments, Betty. Thank you. I think we recognize that the health information technology infrastructure needed to track vaccinations for COVID wasn't an intentional kind of well thought out model. It really evolved over time, and now we're in a position where we need to have these systems in place, and so we're kind of reactively trying to put together what are really quite disparate systems and entities to try and get them to work together. Outside of providers and their electronic health records, there's lots of other organizations ultimately that, to me, need to be involved in the vaccination tracking landscape. Health insurance plans, state and federal registries, the CDC, Medicare and Medicaid, all of these organizations have data that's relevant to understanding who has been vaccinated, who should be prioritized, and yet that isn't where this conversation seems to be focused. So what role do you see these players and others needing to undertake to kind of get a more cohesive and comprehensive management of vaccine data? Betty, do you want to start?
I think that this is going to need to be a central initiative, probably at the federal and state level. We'll need patient identifier created and distributed, and we'll need to start seriously considering using the resources we have, the HIEs in those states that have deployed HIEs and invested in them heavily, and of course have all of the stakeholders in a unified group with appropriate funding to allow the distribution and allocation of resources to put the technology in place to use what we already have to improve the sharing of data around these vaccinations. It likely won't be for this pandemic, but we know that the next pandemic is out there somewhere, and that we need to be better prepared next time.
Marty, what are your thoughts?
Yeah, I mean, I certainly agree with the point that Betty's making. I do think that it's ultimately important for this to be done at a national level and that there's consistency across the board. I think for providers, in the absence of that consistency, it's extremely confusing. And there needs to be, for reporting of vaccinations or other types of reportable services. There's so many providers. If you think about the numbers of points of service where people receive vaccines, there really needs to be a very consistent process and specifications for what's submitted and how it's submitted so that the providers and the infrastructure that supports those providers aren't caught in the middle of what is the current situation, which is so complicated that it's just asking for errors to occur. And for the other small comment that I would make, since you talked a little bit about, mentioned health insurance plans and their role. Yeah. I think in a longer term solution, the role of health plans really should be a backup role, that the primary source of data for these registries really should be coming from where the service is being provided. But if the plans are also submitting based on their claims data, it provides backup information, almost a safety net for the registries to make sure that they're capturing everything. And so I would really see that as a health plan role going forward.
Their Care Quality already integrates SureScripts data. All of the vaccine locations are collecting health insurance information and other pertinent information. The information is there, and it actually coincides well now with the new data blocking rules and regulations that are coming into effect, which will require kind of attention and participation where if there was any reluctance. But just think of the challenge. All of the large pharmacy networks have participated in this national emergency of providing these vaccines. None of their systems communicate. None of the public health systems, none of the kind of entities that have popped up in different states to provide these vaccines are on systems that communicate. We have a very large assignment and job in this area. Yeah. But the least of our problems is the technology.
Yeah.
we know how to do it. It's now a question of will and data governance and regulations that require, fund, and measure success around this.
Thank you both. Let's look toward the light at the end of the tunnel next in terms of COVID vaccination. The CDC issued new guidance this week. I think it came out on Sunday and they revised it Monday for those who are fully vaccinated or considered fully vaccinated. So, Marty, let's just start. Maybe just give us a definition of what the CDC means when they say somebody is fully vaccinated.
Well, the simple answer to that question is you're fully vaccinated 2 weeks after you've received your final dose of vaccine. So for the Pfizer and Moderna vaccines, that's 2 weeks after the second dose. And for the J&J vaccine, that's 2 weeks after the first dose, since it's only a single dose vaccine. What's important to remind people is that if it's been less than 2 weeks since that last shot, or if you've only gotten one of the 2-dose series, you really need to, you're not fully protected, and you really need to take all the same prevention steps that you would as if you're not vaccinated until you're fully vaccinated.
So we've got about 30 million people vaccinated so far in the United States, but we're not out of the woods yet. And while cases are dropping and things are improving, there's still a lot of elements that you're alluding to, Marty, I think, that really haven't changed yet in terms of maintaining various protocols. Just talk a little bit more about kind of what hasn't changed, what still is in place in terms of those guidelines.
Yeah, so in general, when you're out in public, even if you're vaccinated, you still need both to protect yourself to some extent, but even more importantly, to protect others in those situations, so that wearing a mask, staying 6 feet apart from others, avoiding large crowds or poorly ventilated spaces, all those precautions still make sense. And particularly if you're in gatherings with unvaccinated people, if you look at the CDC guidelines, if it's unvaccinated people from more than one household, then you definitely need to be taking all of the standard precautions. Also, of course, if you're around someone who you know is at increased risk of severe illness and hasn't been vaccinated, then of course taking all the precautions is really important as well. Avoid large gatherings, I think, is still a recommendation. And also with regards to travel, I think it's still clear that we shouldn't be traveling unless it's essential. And then if we absolutely have to travel, follow the CDC requirements and recommendations there.
I'd like to hear your perspective. There is some rosier news in this. The CDC actually did ease some of their guidance, and maybe talk a little bit about what's gotten better for those folks that have been vaccinated, and what opportunities now are available.
I think the most exciting part is that the recommendation is now that it's permissible to meet in the home with members of another household if everyone has been vaccinated and completed, as Marty specified, without masks. Mm-hmm. So I think that is so encouraging in terms of reconnecting with grandparents, reconnecting with dear friends, allowing, as the weather opens up, people to socialize and be less isolated. Mm-hmm. Nursing home visitation rules have been kind of lessened, and the limitations have been lessened. And I think that is so important for the older occupants of nursing homes. They have been isolated and lonely, and that has been very difficult for families and them. Yeah. That's very exciting. It's interesting, I have taken a very conservative view of precautions from the beginning of the pandemic. I, as an internist, felt that this time was the real deal, that we needed to be incredibly cautious, that we were dealing with a very dangerous situation. And as you recall, in all of our conversations, I've always erred on the side of caution and taken personal steps to be very careful as well, and recommended to everyone I know. It's interesting, for the first time, I feel that the CDC has had an over-conservative approach as it regards to travel. Mm-hmm. And I actually think that within the next few weeks, probably 4 to 6 weeks, the travel restrictions will be lessened. I think it's I can understand that especially with the variants, you don't want variants to be kind of shipped and moved along. But there's enough background travel occurring that is going to happen anyway. And while we have viruses that are sensitive to the vaccine and there's no evidence that the vaccines are not effective, my feeling was that they were over careful around the travel, but I personally will follow the guidelines and would recommend everyone else does. We need to follow the CDC's recommendations, but I would carefully watch because I think over the next 4 to 6 weeks that's going to change, which will be terrific.
One other positive thing I'd like to mention is the ability for grandparents to visit their grandchildren. That the latest guidelines say that if you're vaccinated and you're going to a household where there are unvaccinated people who are at low risk, you don't have to wear a mask either. So that means that grandparents essentially will be able to go and visit their grandkids, which I think is welcome news across the country.
The only thing I would maybe add to the discussion around travel is I think there is a recognition at the same time that this is a global pandemic, and that until the United States is ahead of a lot of other countries in their access to vaccine supply, and with over 10% of the population now being vaccinated, we're getting there. But that's not the case for the rest of the planet necessarily. And that catch-up period that you're referencing, that 4 to 6 weeks, is probably an important one where, it becomes more of an equal playing field and we are developing herd immunity and there's enough population globally that's in a safe place that we can start opening things up for international travel.
It's interesting. I wonder if one of the solutions will be to continue limiting international travel to countries, to all international travel, or specifically singling out countries that are lagging in their vaccination rates or where serious variants have emerged, versus national or statewide travel. The recommendation currently is very broad and non-specific, which means, do you go across state lines, or that's against the recommendation? If you drive in your own car, is it okay to go across state lines or travel within the U.S.? It hasn't been clarified. There's just a very vague blanket recommendation currently.
Yeah, I would caution all of us to think back to, the beginning of the pandemic, and knowing now that the virus got into the United States more from Europe than it did from China, that this idea that we somehow can pinpoint where the risk is coming from and just block it out. I think the world is so interconnected that we're fooling ourselves if we think we can be that targeted in our approach to prevention.
Yeah, I mean, to me, it feels like it needs to be kind of a truly kind of a global level of activity before we get back to that new normal. I'm sure there's going to be lots of continued developments in this topic, and we'll come back to it in the future. Thanks to Dr. Marty Lustig and Betty Rabinowitz and our listeners for joining us today. Subscribe to our podcast and blog series to keep informed of when we publish new content about the pandemic and other topics impacting healthcare policy, operations, and strategy. This is Graham Brown with NextGen Healthcare. Thanks and have a great day.